37 million. That's the number of Americans currently living with diabetes, an alarming figure. But what's even more dangerous is that millions more have no idea they have the disease. Diabetes can silently destroy your body if left undetected. Are you ignoring the critical warning signs? In today's video, we will help you identify 7 dangerous signs of diabetes that you cannot afford to ignore. Recognizing these symptoms early can help you take better control of your health and prevent severe complications. Let's raise awareness about diabetes together. If you find this video helpful, like and share so more people can learn how to protect their health. Don't forget to subscribe for more essential health updates. 1. Excessive thirst and frequent urination, polydipsia and polyuria. Do you constantly feel thirsty even after drinking enough water? This may not just be due to hot weather or a habit of drinking lots of fluids. It could be an early sign of diabetes, especially when combined with frequent urination, even at night. Warning indicator. A healthy person urinates about 4 to 7 times a day. But if you find yourself going to the bathroom more than 10 times daily, this could be a cause for concern. When blood sugar levels are too high, above 180 milligrams per deciliter, the kidneys try to remove excess glucose by increasing urine production. This leads to dehydration, making you feel constantly thirsty. This cycle repeats, throwing your body into a fluid imbalance that can cause fatigue, dizziness, and even electrolyte imbalances. Scientific evidence. According to the American Diabetes Association, ADA, polydipsia and polyuria are common symptoms of both type 1 and type 2 diabetes. A study from Mayo Clinic also found that 80% of diabetic patients experienced these symptoms before being diagnosed. Check yourself if you drink more water than usual but still feel thirsty, wake up multiple times at night to urinate, experience dry mouth, a sticky tongue, and dehydrated skin. Don't ignore these signs. If you have these symptoms, check your blood sugar immediately and consult a doctor for early intervention. Hit like and share so more people can recognize this crucial warning sign. 2. Persistent fatigue despite resting well. Have you ever felt exhausted even after a full night's sleep? This isn't always due to stress or lack of rest. It could be an early warning sign of diabetes. When blood sugar levels are too high, your body fails to convert glucose into energy efficiently, making you feel constantly tired and sluggish. According to the Centers for Disease Control and Prevention, CDC, 61% of diabetes patients reported experiencing persistent fatigue before diagnosis. Their bodies were in a state of energy deficiency because glucose was trapped in the blood instead of being absorbed into the cells. This is similar to having a full tank of gas but a car that won't start. Another reason diabetics feel exhausted is dehydration. Frequent urination leads to a loss of fluids and electrolytes, making it difficult for the body to function properly. Additionally, diabetics often suffer from poor sleep quality due to high blood sugar levels, which disrupts sleep and causes frequent nighttime awakenings. If you frequently feel fatigued without a clear reason, check if you also experience excessive thirst, unexplained weight loss, numbness or tingling in your hands and feet. Ignoring this symptom can allow diabetes to progress unnoticed, leading to nerve damage, kidney failure, and heart disease. Check your blood sugar early to protect your long-term health. 3. Slow healing wounds. Don't ignore this body signal. Have you ever had a small cut or scratch that took an unusually long time to heal? If so, don't just blame it on aging or genetics. Slow healing wounds are a critical warning sign of diabetes that many people overlook. When blood sugar levels are high, the blood becomes thicker, making circulation to injured areas much slower. This means cells don't receive enough oxygen and nutrients to heal quickly. Additionally, the immune system weakens, increasing the risk of infection. For wounds on the feet, improper care can lead to diabetic foot ulcers, one of the leading causes of amputation in diabetic patients. Magnifying glass scientific evidence. According to the American Diabetes Association, ADA, diabetics have 2 to 3 times higher risk of developing infected wounds than non-diabetics. A minor cut that might heal in days for a healthy person can take weeks or even months for someone with diabetes. Be cautious if you notice cuts, bruises, or scrapes that take too long to heal. Increased susceptibility to infections, changes in skin texture, especially on the feet, Take action now. Check your feet daily. Maintain proper hygiene. And don't ignore any wound. No matter how small, your body always sends signals when something is wrong. Your job is to listen and act quickly. If you have these signs, consult a doctor immediately for early intervention and prevention. 4. Blurred vision. When your eyes send an emergency signal. Have you ever felt your vision suddenly becoming blurry and hard to focus? Even though you've never had eyesight problems before? If so, don't rush to get new glasses just yet. Blurred vision can be an early sign of diabetes, one that many people often overlook. High blood sugar levels can cause the lens in your eyes to swell due to changes in fluid levels, affecting its ability to focus properly and leading to blurred vision. If left unchecked, this condition can progress into diabetic retinopathy, one of the leading causes of blindness in adults. Dr. Ann Summers, an ophthalmologist and a member of the American Academy of Ophthalmology, AO, warns, one of the most common signs of undiagnosed diabetes is sudden changes in vision. Many patients come in thinking they need new glasses, but in reality, high blood sugar levels are altering the shape of their eye lens, leading to blurred vision. According to research from the National Eye Institute, NEI, up to 40% of diabetes patients develop vision problems within the first 5 years if their blood sugar is not well controlled. If you notice sudden blurry vision, check your blood sugar levels immediately and schedule an appointment with a doctor. Adjusting your diet, maintaining blood sugar control, and having regular eye exams are the best ways to protect your vision from the irreversible damage caused by diabetes. 5. Numbness and tingling in hands and feet, signs of nerve damage. If you frequently experience numbness, tingling, or a pins and needles sensation in your hands or feet, don't dismiss it as just poor posture or sitting too long. This could be a sign of diabetic neuropathy, one of the most common and dangerous complications of diabetes. When blood sugar levels remain too high for a prolonged period, the nerves, especially in the feet, toes, and hands, can become damaged due to poor circulation and inflammation. This reduces the ability to feel pain, heat, or cold. In severe cases, it can even lead to complete loss of sensation, increasing the risk of foot ulcers and infections. Alarming statistics. According to the National Institutes of Health, NIH, about 50% of diabetes patients experience some level of nerve damage. Over 30% of patients fail to notice foot ulcers due to nerve damage, leading to severe infections. If left uncontrolled, the risk of limb amputation due to diabetes is as high as 15%. If you start feeling numbness, tingling, burning sensations, or loss of feeling in your hands and feet, take this seriously. Get your blood sugar, blood pressure, and HbA1c levels checked immediately to assess your risk. Protecting your nerves by keeping blood sugar levels stable, taking vitamin B12, engaging in light exercise, and inspecting your feet daily can help prevent dangerous complications. Don't wait until it's too late. 6. Constant hunger. When your body cries for energy. As a diabetes specialist, I often hear patients complain that they feel constantly hungry, even right after eating. This isn't just about not eating enough, it could be a sign of glucose metabolism dysfunction, an early symptom of diabetes. When you eat, your body breaks down carbohydrates into glucose, the primary energy source for cells. However, in people with diabetes, insulin is either ineffective or insufficient, preventing glucose from entering cells. As a result, sugar remains in the bloodstream, while cells remain starved of energy. In response, your body triggers hunger signals, making you feel the urge to eat even when you don't actually need more energy. This condition is known as polyphagia, excessive hunger. According to the American Diabetes Association, ADA, persistent hunger is a common symptom in prediabetes and type 2 diabetes. A study from Harvard University found that nearly 45% of newly diagnosed diabetes patients reported feeling significantly hungrier than usual months before their diagnosis. If you eat more but still lose weight, crave sweets, or get irritable when hungry, monitor your blood sugar levels carefully. The best solution is to maintain a diet rich in protein, healthy fats, and fiber, which helps regulate blood sugar levels and prevent insulin spikes. Don't ignore unexplained hunger. It could be your body's way of sending an urgent warning. 7. Dry mouth. when your body loses its fluid balance. If you constantly feel dry mouth, difficulty swallowing, or persistent bad breath, it might not just be due to dehydration. Xerostomia, dry mouth, is a common symptom of diabetes and can lead to serious health issues if left unchecked. After discussing constant hunger, another issue I often see in diabetes patients is dehydration caused by high blood sugar levels. When blood sugar is high, the body tries to remove excess glucose through urine, leading to fluid loss. As a result, saliva production decreases, leaving your mouth dry and more vulnerable to infections. According to the National Institute of Dental and Craniofacial Research, NIH, over 40% of diabetes patients experience chronic dry mouth, which increases their risk of tooth decay, gum disease, and mouth ulcers. The American Dental Association, ADA, also reports that people with diabetes-related dry mouth have a 60% higher risk of gum disease compared to the general population. If you experience persistent thirst, dry tongue, cracks in the lips, or bad breath, check your blood sugar levels. To reduce dry mouth symptoms, drink plenty of water, avoid alcohol and smoking, chew sugar-free gum to stimulate saliva production. Diabetes doesn't just affect blood sugar, it impacts your entire body. Seemingly minor signs like dry mouth, constant hunger, blurred vision, or tingling hands and feet could be important warning signals. Listen to your body and act before it's too late. What is your body trying to tell you? There are subtle signs that carry powerful warnings. An unexplainable thirst, sudden blurry vision, or a tingling sensation in your toes. These could all be important clues. Diabetes doesn't announce itself loudly. It silently creeps in, slowly robbing you of your health, sometimes without you even realizing it. But this is just part of the story. What happens if these signs are ignored? And more importantly, what can you do right now to regain control? Don't let these warning signals fade into silence. Listen to your body. Take action before it's too late. And if you want to uncover the hidden dangers of diabetes complications, stay tuned for what's coming next.